Research suggests that a new strain, GII17P17, is a key driver behind the surge in norovirus, having been detected in nearly 7 out of 10 outbreaks in the United States this season. This strain has displaced a previous dominant strain, potentially due to lower population immunity, explaining the unusual wave. Outbreaks are commonly reported in settings like healthcare facilities, restaurants, schools, childcare centers, and cruise ships, with long-term care facilities accounting for over half of U.S. outbreaks. Symptoms include nausea, stomach pain, body aches, headache, and fever, typically lasting 1 to 3 days, with severe cases more common in vulnerable groups like infants, the elderly, and immunocompromised individuals. Transmission occurs via the fecal-oral route, with as few as 10 viral particles needed to cause infection, making outbreaks hard to control, especially in close contact settings. Norovirus, often referred to as the stomach flu, is a highly contagious virus causing vomiting and diarrhea, and it is the leading cause of foodborne illness in the U.S., with an estimated 19 to 21 million illnesses annually. Recent data from the CDC indicates a significant increase in outbreaks, with 1,676 reported from August 1, 2024, to February 5, 2025, compared to 729 during the same period last year, as per the CDC's Norostat data. This surge is particularly notable in the winter months, with outbreaks most common from November to April, when people are in closer quarters. Specific weekly data shows a sharp rise, with 91 suspected or confirmed outbreaks reported for the week ending December 5, 2024, up from 69 the previous week, exceeding any other week in 2024 and the same week in previous years, according to CIDRAP. By early January 2025, the number reached 97 for the week ending January 9th, and at least 128 the week prior, more than double the number recorded during the same period over the last 3 years. This early peak, reaching the highest level for this time of year since 2012, marks a shift from recent years when peaks typically occurred in March or April. An unexpected detail is the timing of this surge, with outbreaks hitting earlier than usual, driven by seasonal gatherings and travel, contrasting with the disrupted patterns during the COVID-19 pandemic. The CDC's National Respiratory and Enteric Virus Surveillance System reported 22% of norovirus tests positive for the week ending December 21, 2024, higher than seen in recent years. Norovirus, also known as winter vomiting, is a highly contagious stomach virus that spreads like wildfire, especially during the colder months. Several characteristics contribute to its ease of transmission. Low infectious dose. Research suggests that norovirus requires only a small number of viral particles to cause infection, with as few as 10 particles sufficient to make someone sick. This low threshold means even minimal exposure can lead to illness, making outbreaks hard to control, especially in close contact settings. Multiple modes of transmission. The evidence leans toward norovirus spreading through various routes, including direct contact with infected individuals, such as caring for them or sharing utensils, consuming contaminated food or water, and touching contaminated surfaces. It can also be aerosolized through vomiting, potentially spreading through the air. This versatility in transmission modes amplifies its contagiousness. Environmental stability. Norovirus is remarkably resilient, capable of surviving on surfaces for days or even weeks, depending on conditions. It can withstand temperatures as high as 145 degrees Fahrenheit and is resistant to chlorinated water. This stability allows it to persist in the environment, increasing the risk of indirect transmission through contaminated objects. High infectivity in close contact settings. Outbreaks are commonly reported in settings like healthcare facilities, restaurants, schools, childcare centers, and cruise ships, with long-term care facilities accounting for over half of U.S. outbreaks. Its ability to spread rapidly in crowded environments, where people are in close proximity, exacerbates its contagiousness. An unexpected detail is the virus's high genetic diversity and rapid evolution, with new variants like GII17, P17 emerging, potentially contributing to increased transmission rates as reported. This diversity complicates control efforts, as population immunity to one strain may not protect against another. Given the recent surge in norovirus cases, preventive measures are crucial. The following strategies, based on current guidance, can help reduce infection risk. Hand hygiene. It seems likely that frequent hand washing with soap and water is the most effective way to prevent norovirus, especially since alcohol-based hand sanitizers are less effective against this non-enveloped virus. The CDC emphasizes washing hands after using the toilet, before eating, and before preparing food, as hand sanitizers might not remove all types of germs, particularly when hands are heavily contaminated. This is critical during surges, given the virus's low infectious dose. Food safety. Avoiding consumption of raw or undercooked shellfish, particularly oysters, is essential. Ensure all food is properly cooked and handled to prevent contamination, as foodborne transmission is a major route. Surface disinfection. Cleaning and disinfecting surfaces that may be contaminated is vital, given norovirus's environmental stability. Use disinfectants effective against non-enveloped viruses, such as chlorine bleach at a concentration of at least 5,000 ppm, for at least 10 minutes, as recommended by the CDC. This is particularly important in high-risk settings like hospitals and schools to break the chain of transmission. Isolation of infected individuals. If infected, individuals should stay home and avoid contact with others until they are symptom-free for at least 48 hours, as per CDC guidance. This helps prevent further spread, especially during outbreaks, given the virus's high infectivity in close contact settings. Good hygiene practices in high-risk settings. In places like nursing homes, schools, and cruise ships, strict infection control measures, including enhanced cleaning and isolation protocols, are necessary to prevent outbreaks. Travelers should practice good hygiene and be cautious with food and water, particularly on cruise ships known for norovirus outbreaks. While there are norovirus vaccine candidates in development, including live attenuated and virus-like particle vaccines, none are currently licensed for use, so prevention relies heavily on these hygiene and sanitation practices. The recent surge, driven by the GII17P17 strain, underscores the importance of these measures, as lower population immunity to new strains may exacerbate transmission. The CDC is actively monitoring the situation through surveillance systems like Norostat, which provides real-time reporting of outbreak activity in 14 states, and CaliciNet, a network for genotyping norovirus samples. They have reported the increased numbers and trends, emphasizing the importance of prompt investigation and reporting to identify causes and spread, as per their outbreak response page. The CDC collaborates with state health departments to collect specimens, perform diagnostic testing, and provide epidemiologic consultation, ensuring a coordinated response. They also offer guidance on prevention, such as hand washing and proper food handling, to reduce transmission. The FDA has taken specific actions to address foodborne norovirus outbreaks, given the virus's association with contaminated food, particularly oysters and berries. They have issued multiple advisories and recalls, such as advising against serving or selling oysters harvested from December 2nd to December 17th, 2024, by Rucos shellfish from Washington state due to norovirus contamination, as reported by Forbes. Another recall was issued for oysters and manila clams harvested from November 15th to December 11th, 2024, by Rudy's shellfish from Pickering Passage, Washington, as per an FDA alert. Most recently, on February 18th, 2025, the FDA expanded the oyster recall to include those harvested from Louisiana Harvest Area 3 from specific dates due to potential norovirus contamination. This action is part of the FDA's ongoing efforts to ensure food safety and prevent the spread of norovirus through contaminated food sources. The recall advises restaurants, retailers, and consumers not to serve, sell, or consume oysters harvested from Louisiana Area 3 during the specified period, aiming to mitigate further outbreaks linked to foodborne transmission. The FDA is working to ensure food safety by coordinating recalls and advising consumers and retailers to dispose of potentially contaminated products, collaborating with the CDC when food links are identified, as per their strategy for preventing outbreaks linked to fresh and frozen berries. Okay, if you found this video helpful, be sure to like, subscribe, and turn on notifications so you won't miss our upcoming videos. Leave your comments below. We'd love to hear from you and continue the conversation. Thanks for watching, and we'll see you next time.